Hi, it's Dr. Fox. Let's talk about the intrinsic laryngeal muscles. In this video, we'll describe the attachments, innervations, and effects on ventilation and phonation of the intrinsic laryngeal muscles and their parts. Let's start by understanding what's happening at the joints of the laryngoskeleton. And let's start with the cricothyroid joints. There's a lot of information in the name. So cricoid, thyroid. So the cricothyroid joint is a hinged joint formed between the inferior horn of the thyroid cartilage against the cricoid cartilage. When active, that tips the thyroid cartilage anteriorly and slightly downward. Now, because the vocal ligaments run between the arytenoid cartilages and the thyroid cartilage, when that thyroid cartilage tips downward, that applies more tension on the vocal ligaments. Keep in mind that tension is proportional to pitch. So as tension increases, pitch also increases. The cricothyroid joint is moved by the cricothyroid muscles on either side, and these are flanking the median cricothyroid ligament. So when the cricothyroid muscles activate, pitch increases. These are the only intrinsic laryngeal muscles which are innervated not by the recurrent laryngeal nerves, but by the external branch of the superior laryngeal nerve, which is another branch of a vagus nerve. Now let's look at the cricoarytenoid joints. So cricoid, arytenoid. So the arytenoid cartilages sit atop the cricoid cartilage, and they're capable of several movements. Firstly, they may glide. There are muscles connecting each arytenoid cartilage, and what happens is when they contract, that glides the arytenoid cartilages together. That has the effect of adducting the vocal ligaments and bringing the ligaments closer together for phonation. Another type of movement possible at these joints is that of rotation. Now, there are two different sets of muscles which are capable of two different directions of rotation. There are the lateral cricoarytenoid muscles. The lateral cricoarytenoid muscles are between the lateral aspect of the cricoid and the muscular processes of the arytenoid. So when they contract, they are going to rotate the vocal processes inward. So they will adduct the vocal ligaments. So again, closing the rima glottis, putting it in a position for phonation. The other type of rotation is complements of the posterior cricoarytenoid muscles. So these attach to the posterior surface of the cricoid to the muscular process of the arytenoid cartilage. And when these contract, they rotate vocal processes of the arytenoid cartilages outwards, so as to abduct the vocal ligaments to put them in a position for optimal ventilation, for moving air. What's curious is that out of all of the intrinsic muscles of the larynx, there's only one set which opens up the airway for ventilation. Let's take a look at some of the arytenoid muscles in greater detail. So we're not talking about these. Those are the posterior cricoarytenoid muscles. We're talking about these. Those are the oblique arytenoids, and these, which are the transverse arytenoid muscles. So let me uncover those so that you can look at them while I talk about them. So the arytenoid muscles are going to adduct the arytenoid cartilages and, as a consequence, also adduct the vocal ligaments. So we are narrowing the rima glottis, putting it in a position for phonation. Now, there's also, owing to these parts of the oblique arytenoid muscle the ability of narrowing the laryngeal inlet and slightly depressing the epiglottis through contraction. This is a protective maneuver performed during swallowing or deglutition so that we are discouraging food or beverage from entering into the respiratory tract. The arytenoid muscles, like all but the cricothyroid muscles, are innervated by the recurrent laryngeal muscles, branches of the vagus. So let's look at the lateral cricoarytenoid muscle. These are the muscles which are going to medially pivot the vocal processes and vocal ligaments, to adduct the ligaments to close the rima glottis, to put it in a position for phonation. This is also a protective position for swallowing too, so that if anything does enter into the larynx, it won't go any further along the respiratory tract. Now let's take a look at this view of the cadaveric donor larynx. And to understand what's going on here, there's the epiglottis. The thyroid lamina has been cut and reflected. Here's the trachea. That's the cricoid. So we're looking at a lateral view of this. Anterior is there. And right there is the muscular process of the arytenoid cartilage. And so all of this is the lateral cricoarytenoid muscle. And all of this is the posterior cricoarytenoid muscle. So I'll uncover that so that you can see it. From the illustration, I think we get a better sort of fundamental understanding. So when these pull that way, that medially rotates those vocal ligaments. Again, these are innervated by the recurrent laryngeal nerves. The posterior cricoarytenoid muscles, we can see there and there. In the posterior view of the larynx, they are quite visible, and they laterally pivot the arytenoid cartilages and the vocal processes. By doing so, maximally opening the rima glottis, favoring ventilation. Now, as a result of this, they also slightly pull the arytenoid cartilages posteriorly, and this does increase vocal ligament tension, so it will increase pitch, but the folds are out of position for phonation, and so it really is only going to help produce a high-pitched sound during ventilation. So if you think of this sound, someone drawing in breath, that's complements of a posterior cricoarytenoid muscle, also innervated by the recurrent laryngeal nerves. Finally, let's look at the thyroarytenoid muscles. The thyroarytenoid muscles are between the thyroid cartilage and the arytenoid cartilages there. They flank the vocal ligaments, and they do a couple of different things for them. So, first of all, the more lateral fibers are going to protract the arytenoid cartilages. They will move them forwards. What that does is decreases tension and lowers pitch. But that's not all that these muscles are capable of. The more medial fibers, those that are immediately adjacent to the vocal ligaments, sometimes we call them an entirely separate muscle. We call them the vocalis muscle, even though they're more considered a part of thyroarytenoid muscle. What they do is they increase lateral tension on the vocal ligaments. So if we were to think about a vocal ligament in cross-section, it might look like that. But if we start tugging on it, it flattens the vocal ligament out, like so. What this does is that it affects timbre, or the tonal quality of sound and phonation. It also has the ability of fine-tuning pitch, either up or down. And yes, much like everything but the cricothyroid muscles, the thyroarytenoid muscles are innervated by the recurrent laryngeal nerves. So let us assess our knowledge. Which intrinsic laryngeal muscle is most important for the process of ventilation? Arytenoid, nope, they're for adducting and for phonation. Cricothyroid, nope, they're pitch increasers. Lateral cricoarytenoid muscles, nope, they are adductors for phonation. Posterior cricoarytenoid muscles, ding, yes, that is correct. Thyroarytenoid muscles, nope, they lower pitch or affect timbre or finely tuned pitch. So the correct answer here, if you're optimizing for ventilation, it's all about the posterior cricoarytenoid muscles. Thank you so much, and I look forward to talking to you in the next video.